everyone here to Littleton. Thank you for joining us. I'm Mayor Kyle Schlechter of Littleton. I just wanted to do a quick housekeeping notes that everyone needs to use the restroom here up the hallway, kind of doors right across from the wall right here. And we are broadcasting this meeting on at least the Littleton channels on Facebook, on Channel 8, on our website. I don't know if that's been good. We sent the link. I don't know if you're doing that, but the recording will be hosted by us. But just looking forward to the discussion here. I know it's been about a year since we did this last, and just want to go around the room and do quick introductions. And I'll throw it over here to Mrs. Littlefingers. Literally.
Steve Barr, Mayor Pro Tem of Littleton.
Benson, City Attorney.
Cameron Niles, City Attorney of Inglewood.
Sean Lewis, City Manager, Inglewood.
Tim Dodd, Deputy City Manager at Inglewood.
Kathleen Osher, Deputy City Manager, Littleton.
Liz Ramsey, the Management Fellow at Inglewood.
Nathaniel Sierra, Mayor for the City of Inglewood.
Pam Broke, Littleton City Council at Large.
Jim Duckenberg, Littleton City Manager.
Mike Gent, Littleton Deputy City Manager.
Carrie Warren Gully, Arapahoe County Commissioner.
Chelsea Camp, Inglewood City Council District 2.
Joe Anderson, Mayor Pro Tem District 3 Council in Inglewood.
Stephen Ward, Inglewood District 4 City Council.
Rita Russell, Inglewood City Council Member at Large.
Kim Wright, City Council Member at Large.
Gretchen Ryden, Littleton City Council, and elected to our state legislature to serve for House District 38. So I'm really excited. This topic is really important to me, so making sure we have as much support and resources at the state level will be key.
Leslie Summy, Arapahoe County Commissioner, District 4.
Jay Whitaker, Sheridan City Council.
Devin Granberry, City Manager, Sheridan.
Desiree Stang, Sheridan City Council.
Michael Moreno, Sheridan City Council.
Ernie Camacho, City Council, Sheridan City Council.
Anthony Lopez, City of Sheridan Council.
Fairbider Fleur, Mayor, Sheridan.
Robert Reichart, Littleton City Council.
Jessica Cox, Tri-Cities, Homeless Service Coordinator, Arapahoe County.
Dennis Quinn, Library Director, City of Littleton.
Jeremy Fink, Arapahoe County Community Development.
Great. Well, that wraps up my 5 minutes of welcome. Turn over to Devin to give us a history of Tri-Cities homelessness.
Thank you, Mayor. Hold on, let me get to where I need to be on that. Sorry about this. Okay, so I'm going to talk a little bit. Does anybody care if I stand up?
That'd be great.
Talk better when I stand. Okay, so talk a little bit about the history of this group, the policy committee, and I think I know there are a few of us that have been there since day one. Mayor, who else has been there since day one? Is it just you and me in this room right now? Well, Reed. You were kind of, yeah.
Physically.
But it came about officially. Discussions started in 2018. So Tri-Cities had been getting together actually for years before this. So the Tri-Cities councils would get together kind of on an annual basis, more or less, and kind of really was at that point it was more of a sharing what's going on in our community type of thing. Discussion, especially when Mayor Olson kind of was the point person on saying let's do a little bit more than just talking about what's going on, and so she was one of the driving forces behind looking at forming more of a subcommittee to look at an issue, and that issue kind of really morphed into homeless. What was something, the discussion of what was something that was affecting all of us? Where was something we could work on regionally? So we formalized that late 2018. We established a charter for that. Sama Fox did a lot of work on that. When Sama was with Littleton here, I want to make sure that she gets credit and a mention on that because she did a lot of the early work in getting us organized and getting us formed. Good slide up there. So we have a mission: promote and coordinate amongst them between the cities of Inglewood, Littleton, and Sheridan. And the goals: understand the homeless situation in Tri-Cities. At the time, we didn't know what we didn't know. I mean, we knew that we needed to understand this. We knew it was important. We knew it was a need. We knew we needed to understand it better than we did. or did at the time. We needed to work proactively to ensure legislation across the 3 cities is supportive and consistent, that we work collaboratively. And that's at not only at the elected official, but at the staff levels as well. And that education was going to be really key. Not only educating ourselves over the issue and what we needed to learn, but educating, making sure that we were able to educate our community and our stakeholders as this so well. Go ahead, Mike. This I'm going to talk about something else. So what did we when we decided we needed to educate ourselves? We did a couple of things. One, we engaged in the University of Denver. So we did the DU Center on Housing and Homeless Research. That's what they're called now. I can't remember what they were called at the time when we when we contracted with them. But they did a couple things for us. They did a couple of studies. They did one study that focused on individual chronic homelessness, and one that studied centered on family homelessness. And it was specific to our Tri-Cities area. We didn't just want a general look at the region or anything like that. We wanted it to be specific to our Tri-Cities region. We also did a PESTEL analysis, and that stands for the political, economic, social, technological, environmental, and legal analysis. And it's kind of a SWOT analysis, or strengths and weaknesses in each of those areas. What's working, what's not in those areas for us. You can see this slide kind of points towards some of the results. A summary of some of the results came out of one side of the studies that DU did for us, the chronic individual homelessness. My takeaways from this, without going over every one of those, you can see those and look at those in your packet. My takeaways from this is that most of the common causes and barriers in this right here that people are experiencing are economic. They're economic related, all right? So they're economic issues. That's what most of them share in common, is that they have not. And the other thing that I take away from this is that there are a lot of causes and barriers here. A lot of causes of homelessness, a lot of different barriers to housing. The saying is that if you've met a person experiencing homelessness, you have met one person experiencing homelessness. That one person's story is not indicative of everybody else and their experience. Every experience is unique. Go on to the next one. On the family side, very similar. Again, the top numbers that you see here on most common for causes of homelessness and barriers to housing are economic related, right? Unable to pay the rent, right up there. Housing costs too high. They lost a job, change in employment, things like that that are economic factors. Okay. There's not a slide for this, so I'll just kind of talk this, but you can leave that right there. Some of the findings that I'm just going to run through really quick, and then I know that our elected officials are going to or touch on this a little bit more on some of these. But what were some of the findings we had out of those efforts to educate ourselves? One, that we needed to strengthen our local and regional coordination. And that's amongst the Tri-City group itself, with our staffs, our elected boards, but then also regionally, what's going on in Denver, what's going on in the larger region, and how do we coordinate efforts across those? How do we address the unique needs of families and individuals, recognizing that the needs of families and the needs of individuals are not the same when they're experiencing homelessness. They're very different, and we need to be aware of that, and we need to plan for that. How do we streamline access to homeless services and provide navigation support, NAB Center? So we'll talk on that a little bit more. Increased participation among homeless service organizations in data collection. We wanted to make sure that we were being very purposeful in being data-driven in our policy when and where we could be. Provide an alternative to law enforcement to proactively respond to people experiencing homelessness. Our police officers were not trained in this. They were not. This was not their bread and butter as far as dealing with a lot of the issues they dealt with when they responded to people that were experiencing homelessness. So we needed to look at what are some alternatives that, or how assistance we give to that. Co-responder program comes up. We'll talk about that. How do we leverage partnerships and public and private partners? We've got All Health, Change the Trend, street outreach, all these kind of things now that we'll speak about. And then how do we expand housing opportunities? Because at the bottom line, homelessness is a housing issue. Okay, developing the action plan. So we had the DU plans that were done, the PESTEL that was done. There was regional and state plans that were out there. There were the efforts that Mile High or MDHI was doing, among others, other counties, other areas that were efforts. So we need to kind of figure out what do we do as far as wrapping our arms around this, and how do we prioritize, and how do we focus on this. So we hired a consultant. Dr. Orduña, Dr. Alyssa, I believe it was, Alyssa Orduña, really helped us with the goal and a direction to help us wrap our arms around all this information that we have now and prioritize and focus. To do a lot of that, you can see she conducted a number of stakeholder interviews across all 3 cities, the county, other law enforcement, other stakeholders that we had out there. Asked them a number of standard questions, but then also we wanted to have some open questions in there so you can see what they asked. She asked what's working, what can be improved, and how do we prioritize those. She put her arms around all of that information, and then that began the direction for building the action plan. Coming out of the action plan, we had really 4 themes that came out of that effort that Dr. Orduña helped us focus our first action plan on. It was basically building a strong foundation, which is around governance. We had, so strong governance, being data-driven in our approach, and then engagement and education for the community. This is not up there, Mike, so don't worry about it. I'm sorry, I'm going off script. A single adult system. How do we streamline access for that? For people that need homeless services as a single adult. How do we provide and get in street-based services? And again, housing opportunities. What can we do for housing opportunities? Workforce development, which we'll speak to as well. What kind of partnerships are there out there that we can have? And what kind of employment opportunities along with that? And then the family. We don't want to forget the family. Recognizing that we need to have separate approaches, again, for the individual and for the families that are out there. How do we streamline things for families? How do we prevent? Where do we get into prevention here for families? Which is a real focus, and when we work with the school districts, how do we prevent? And then again, housing opportunities, okay? So she helped us put together the draft, got the action plan in front of everybody, and the council's reviewed and approved, and then we needed to get into implementation. So when implementing this plan, we hired a Tri-Cities homelessness coordinator. This is kind of in the beginning of like the county getting really involved with us and becoming partners at the table when we needed to take this next step of hiring a coordinator. The county was very instrumental in helping us to bring somebody on board and figuring out how that was going to work for not only Tri-Cities but for the county and their efforts as well, and sharing that position. So Mike Sandgren was our first hire on that. He was at the time was the director of Change the Trend and their efforts that they were doing there. Now we're very lucky to have Jessica with us. Jessica, raise your hand if you haven't met Jessica yet. Yep. And Jessica, when did you come on board? It's been about
June.
June, yeah, so I was gonna say 6 months, so yeah, about, maybe a little bit more, yeah, okay. But she's been doing a great job, and it really hasn't been like having to get up to speed. She just hit the ground running and took off, so she's doing fantastic. We launched, we got into performance metrics, and I think Jesse's gonna talk about some of those metrics here in a little bit here, so I'm not gonna get into that at all. We did a nice, one of the initial steps in getting things rolling was doing a feasibility study for the Bridge House Ready to Work program, which was instrumental in not only educating ourselves and educating the councils and getting that buy-in on that, but also Bridge House, that they could bring a facility here and that, if they build it, will it work? So that was a great effort there to help on that. The city's really stepped up, and the county, $1.5 million ARPA funding. We launched annual Homeless Connect events and then implemented the co-responder program, which I know everybody's aware of there. Last slide, I'm gonna go quick here now. Engaging the community. Again, that was also one of our big focuses, and I think that the group has done a good job on that as far as a number of different events throughout the communities, throughout engaging a number of the stakeholders. Different groups are out there, so it gives you just a little bit of an idea there. And I know each of the cities have hosted roundtables and forums and all that too, so I think there's been quite a bit of great outreach for that. And then throw in the online presence and a number of things. So some good efforts on that right now. Now it's kind of time to start talking, what is our next steps? What is Action Plan 2.0? Where do we go from here? And I think I'm handing it off, before we talk into Action Plan 2.0, I think I'm handing it off to Mayor, or am I handing it off to you?
Yes.
And then you're getting into about just a little bit more of
Pass it
the
around.
accomplishments. Thank you.
Thank you. All right, so I'm going to talk a little bit about some of our accomplishments, and the other electeds who are represented on the Tri-Cities Homeless Policy Group will jump in here and also cover some of our accomplishments that we've managed to achieve in the first phase of the action plan. So I'm going to walk right through these numbers that you see here. The recommendations are actually from the action plan. And so you can see recommendation 1.1 was to build a strong governance structure. And that is formalized in our Tri-Cities Homeless Policy Group. And within that group, we have voting members and we have a steering committee. The voting members of that body are the 3 electeds plus the 3 city managers. And then we have various people who participate in the Homeless Policy Group every month. We have representatives from Change the Trend, from other nonprofits that are active in our communities, from the county, from health services providers, co-responders, so we police departments. So we have a lot of different participants in kind of that body in general, and then we have a core of voting members who provide the leadership of that group. So that is that formal body. And then we also created the homelessness coordinator position, as we've covered, that Mike Sangren started in and Jessica has picked up. And while Mike was still our coordinator, he set up the Lived Experience Advisory Board. The idea being there to make sure that we have the voices of people who are actually experiencing homelessness or have experienced homelessness feeding into our plans so that we know that we're on the right track and we're really meeting their needs. Recommendation 1.2 was to formalize the data-driven approach to guide allocation of homelessness resources. This was done a lot in partnership. So the first item there is increased participation in homelessness management information system. This is the system that is hosted regionally by the Metro Denver Homeless Initiative. So how this is used in our area is anyone who's providing services to the homeless can input their data into this system, and that can help coordinate the services that those people who are receiving services get. And it kind of ties in with the next one, the Metro Denver Homeless Initiative's One Home Coordinated Entry System. That part is when you are kind of onboarding someone who's experiencing homelessness, you get all the information about them, it goes into the One Home system, and then they get prioritized for housing assistance. So there's kind of 2 different parts of it there. They're both kind of data systems to keep track of who's getting what services. And so we have been able to increase the organizations in our area that are using both of these systems so that the people in our area get prioritized for housing, get prioritized for services. And then partnering with Community Solutions Built for Zero initiative. This is a nationwide initiative, but there's also kind of a subgroup here in the Denver Metro and even throughout Colorado of Built for Zero. And what we've done so far in that, it's, as it says there, addressing the needs of specific subpopulations. We were able to finish a by name list for veterans in our 3 cities. So that means the by name list means we really have actually listed everyone that we know that we can find who is a veteran who needs services. And that's a huge step to be able to provide services, because once you have that list, then all the different providers can kind of get in there and case manage for those people and bring their own different services to that person and try to get a solution for them. So it's an important building block to helping all those people get out of homelessness. And so that was a big success to get that list done, and I believe they're still in the process of putting that list together for homeless individuals. And then develop the system of tracking and reporting plan implementation and outcome achievement. That is incorporated on our website, which is kind of the next point on here, but we have a website called tricitieshomeless.com. And all of the statistics that we're tracking are posted there. So on that next point, on the next slide, it says create community education and engagement strategy. So we did create that webpage that has the statistics. It also has what all the resources are that we have in our cities. And ways for people in the public to contribute to help out. And the final point on here, we have create a welcome home community engagement program. That's a pretty recent achievement that Jessica's been working on. She'll probably update on that as well, but the idea was to be able to give something to those folks who are able to transition into housing to kind of support them. So I think there's a landlord engagement component to this, but it's basically giving the landlords kind of a welcome package that they can then give to that person who's moving into housing as a way to help them transition and have what they need to be living on their own in housing. All right, I'm gonna pass it off to Councilmember Ryden at the end.
All right. A lot of the things you'll hear tonight too will sound redundant or at least repetitive, and that is intentional because these were all recommendations that have some overlap. But that just means we were very hyper-focused in executing on this plan, and that's why it's pretty much will be all complete within the next couple months, which is pretty exciting. So a single adult system, Devin alluded to this. The most visible unhoused tend to be single individuals that you see. So we kind of split this up into single, focusing on unhoused who are single and unhoused who are families. Those who are families have a little bit more access to more services. Not to say that they're not a priority, actually they are a priority, that's why there's more services already available. But we wanted to pull out what are we doing for the individuals that you see on the street. So again, that is the most visible and they tend to be males. So what we needed to do is convene all of our providers so that get them all on the same page. Before this action plan launched, we really weren't doing that in a coordinated way. So my day job is I'm a social worker. Love social workers, love my profession, but sometimes we don't always talk to necessarily everybody around us. So I might have a client who's receiving services through my agency, but they might also be receiving those services through another agency, and we're not talking. So now we have more sort of bureaucracy that's being created, and it's not necessarily being helpful to the customer or to the client. So part of this was getting everybody on the same page and have one line of entry point. Tara mentioned this earlier, that entry point is it's not HDMI, that's the cable, but it's HDMI. I already always inverted. Thank you. Yes, that is our single entry point. So but you have to get trained in order to use it. You have to create user accounts in order to get case managers, to get social workers to be able to using that system. That means that if I run into somebody, I'm a case manager, and I can look them up in real time to see if they're receiving services elsewhere or what benefits they've already applied for, or where they are in the housing application process. So we're not duplicating service. So that is a big deliverable for us to be able to just get people trained and everybody using the same language. As you know, with nonprofits, sometimes there's a different language we use to describe the services we're providing. So it was also getting everybody on the same page about that and having, again, that one point of entry for our individually who are unhoused. What Tara also mentioned is we were then able to create a list so that we knew by name who we are serving, which is pretty incredible when you think of how large Arapahoe County is and how large even our Tri-Cities are, that we know who is unhoused for the most part at any given time. We also had a recommendation to make sure we were thinking about the mental health and the physical health, the well-being of those individuals. So we needed to create an outreach team. Jess is going to talk more about the PATH team, which is kind of who we identified to do this. PATH is run by All Health Network, and they obtained a federal grant. So we actually really didn't put in any dollars in order to do that. That also means that when that grant comes up for renewal, they might need some support from us, and that also means it's vulnerable to future funding, so something you should all think about in the years to come. But that outreach team is staffed with a therapist, and a couple case managers, and they work really strongly in collaboration with our co-responders. So part of this outreach team was also bolstering up our police departments and our co-responder program. So Littleton, we were able to hire another social worker to do more of some of that case management support for the folks that people are engaging with on the street. Englewood also started the mobile response unit. And that means we were able to start finally tracking, and Devin mentioned this earlier, the data points, start tracking, well, what is the number of calls that involve the unhoused? What is their demographics? And that started with Englewood being willing to do that, and then we were able to get some intergovernmental agreements to kind of tack onto that. So All Health Network also runs that mobile response unit, and they have a very high success rate. And then again, that's supposed to be an alternative to police involvement, but it's still run through dispatch. So we were able to launch that successfully, and I think it's going well. And maybe Jessica will talk a little bit more about some of the specifics behind that as. But that is also, based on funding available to All Health Network to keep that program going. And then the last piece on here is exploring, well, that takes care of some of the crisis, support, but what about the physical support? So in that why am I blanking? Mobile response unit. Thank you. That includes a nurse. So a nurse can take care of superficial wounds, which again is theoretically supposed to prevent folks from using the very expensive hospital system. However, it's not, they can't go beyond that. So their limitations is, they're pretty limited in who they can serve. So they could treat maybe some, potential burns or maybe some frostbite. For anything more severe, we still have to transport them to the hospital. So we wanted to explore, well, we know other communities have street outreach that's actually happening on the street where they're doing a little bit more high complex health-related cases. Could we explore something like this? I think Jess will talk more about Stride, but we were able to accomplish that in a partnership with Stride, which is runs out of Denver, and now they're able to serve our South Metro area. That just happened the last couple months, so we're really excited that we will have an option for higher acuity street-based medical services.
All right, it's my turn. I'm talking about recommendation 3.1, which was create partnerships with existing workforce programs. And we have two programs that we're working with. One is the partnership with Bridge House Ready to Work program. The other one was Cross Purpose. I think we were really fortunate here in that both of these organizations were looking to expand. These are both organizations that have multiple centers of operation already in the metro area and have a proven track record. They both have workforce programs that have been successful in the past, and they're both looking to move to the South Metro area at the same time as we were launching our action plan and also had access to the ARPA funding. So we were able to help fund these programs and get them into the Tri-Cities area. So I want to talk a little bit about the difference between the two programs. First of all, Bridge House is a workforce program for homeless folks. And so they have, I think they're going to have about 50 beds in their facility, and they go through a year-long program training in either culinary skills, and they have catering service and cafes that they work with, and then they also have a workforce team for landscaping and sanitation that I believe works with municipal partners. So this will allow us to refer our homeless population to this work program and actually get them into jobs and off the streets along with that. Cross Purpose is slightly different in that they don't target the homeless population. They're dealing with people who are in poverty already, but are not homeless. And so this is a homelessness prevention program in terms of kind of our action plan. And what they do is they have a number of different trades they work with: HVAC, electrical, healthcare, culinary. They do transportation, so get your CDL license. They have a clerical and admin program, sales, and IT programs, others as well. But what they do is they take people who are in entry level or low paying jobs, get them skills to get higher pay to prevent, get them going the other direction, so they aren't going into homelessness. So it's our homelessness prevention program. I think we're really fortunate to have both of these in the Tri-Cities area. The success rate for Cross Purpose is 77% at 6 months after they graduate from the program. That was in 2022. That was the most recent data I could find. And then Bridge House has a 72% success rate as of 2022. So those programs are both ready to launch. Cross Purpose has already launched, been running a couple of years. And Bridge Force, I believe, will launch next year, springtime maybe?
February, March.
February, March. Okay, coming very soon.
That 70% is really high when you look at other programs, and the way they measure that is they look at people whether they're housed a year later after they exit their program. So that means that individual has both employment to keep the housing, and they've been trained in accordance. So we're really excited about that. And the reason we call it Ready to Work is because All Health Network has a facility that they operate that's called Bridge House, that's an acute treatment center also in Littleton. So we're trying to avoid the confusion in case you hear it. It's the same thing. All right, so our family system. Again, because we know there's already a lot of services out there available for families, there's still not enough. So we focused our recommendation on bolstering where are we gonna first hear about who's on families that are unhoused, and that's gonna be in the schools. And by federal law, at least currently, folks are required to be able to track who is unhoused. And then there is some grant money and support available to those families. So we really focused on just knowing who are the contacts in all the schools, so working with Littleton Public Schools, as well as Sheridan Schools and Englewood Schools on just making sure we know who those folks are and that we're tracking in real time. And on our website, on the Tri-Cities website, we have a dashboard that will track this information, and I think it's gonna be discussed later.
So I'm going to speak a little to the data that's driven the work that we are doing, and then data on outcomes that has been a result of the work that we've done. The first is the point in time count data, and I'll first give some context and some background to the data before actually presenting it. So the point in time is a snapshot, one day of the year, what homelessness looks like in a specific area. This is conducted nationwide on an annual basis. Last year it was in January, this year it will be January 27th. And it really plays a determinative role in measuring homelessness rates at the macro scale. So it really is just a quick snapshot. But at the local level, the PIT numbers can serve as a helpful reference point. There are some limitations to the PIT data. Weather variances can play a role in the counts. Volunteer engagement, the more volunteers we have, the farther our reach is. And so for these reasons, the PIT trends really should be viewed with some difference to some other more real-time data. And that's available through the HMIS system, and that's the Homeless Management Information System. So before I get into the data, I just want to clarify that HUD, they define it as sheltered and unsheltered homelessness. And for sheltered, those are individuals or families who are living in transitional housing, emergency shelters, or a safe haven, whereas unsheltered are individuals who are living in encampments, on the streets, sidewalks, bus, train stations. And there is more granular data that is available through MDHI and through HUD. However, I'm gonna speak on a more high level to what that data looks like. So for 2023 and 2024, the point in time totals were higher in the Tri-Cities region. And that was between the combination of sheltered and unsheltered. So 2023, 138 were reported, and that went up to 200 in 2024. And I'll break down that data by each city. In Englewood, for sheltered and unsheltered, there was a decrease in homelessness. So 2023 in Englewood went from 22 to 15, and that's for sheltered. And then for unsheltered individuals, that went from 77 to 60. In Littleton, those numbers went up. So 2023 saw 26 sheltered individuals or families, and that went down to 0, but unsheltered went from 31 to 69. For Sheridan, the totals did go up, so 0 were reported sheltered in 2023, and then in 2024, that went from 2 to 4. And then in 2023 and 2024, the family homelessness totals, those totals did go down from 30 to 28, and that's the combination of the sheltered and unsheltered. And lastly, for veteran homelessness, that went from, in 2023, sheltered went from 1 to 0 in 2024, and then for unsheltered, that number went up in 2023, from 12 to 16 veterans who were identified as experiencing homelessness. And that will kind of blend into the next data that I'll discuss, and that's the Built for Zero. So Built for Zero, as mentioned, it's an initiative through MDHI, and it uses data to address homelessness demographic by demographic.
Oh, I wanna just add something, Jess, that slide before, as I recall, the Littleton number, it looks like it's more than double, right? That we can't parse out Littleton proper and the outs part of Littleton, so just to be clear on that.
So it's Jefferson County's problem.
Can I ask a question? So those numbers, since they changed, how do you know they didn't move from Littleton to Englewood or Sheridan or vice versa? Is that a possibility?
Yes.
That is a possibility. For Built for Zero, the Denver metro area specifically is focusing their efforts on veteran homelessness. And that's done through case conferencing monthly. So it involves all of the service providers that help deliver services and provide support for our veteran community. And it tracks each veteran that's been entered into HMIS by name. And that's where the by name list comes from. And each individual that's on that by name list is case conference with All Health Path, Rocky Mountain Human Services, Home for All Veterans, SAFER, the Arapahoe County Housing Navigators, and everyone kind of troubleshoots how we can best serve these veterans and make sure that they're getting housing. And there are many subregions within Denver that actually are at functional zero. So as we approach functional zero, because we are pretty close, they'll move to a new demographic to kind of focus that by name list and the Built for Zero efforts. So this is the Built for Zero data starting from April 2023 until current November's. We're at 4, so it's a little less than what's displayed here. But as you can see in January 2024, that number that the PIT data captured, 16, it's gone down significantly. So I think that kind of speaks to how effective the by name list is, and how important those efforts are in making sure that we're tracking every veteran and getting rapid rehousing in place for them. And all of this data is available on the Tri-Cities website, and it's updated monthly, so you can always get up-to-date data there.
To the point about the PIT count data changing, from a national level, the main benefit of the point in time count is just creating awareness that homelessness exists in the communities. So that we have much better metrics to use if we're making progress or whatnot. But point in time count really is just saying, yes, there are people in your community experiencing homelessness.
Exactly.
Jessica, can you explain functional
And
zero?
this slide is really important because, look, it's basically saying we can almost eliminate homelessness among a very specific subpopulation. Now, we know we won't ever be able to end homelessness, but that's not the goal per se. The goal really is to make it as short as possible and to have a very quick transition into additional housing. And this, I think, is an example of how you can do that. And there's a lot of case coordination that is involved with all the providers who are making this happen.
And just to kind of touch on functional zero, that is achieved once a certain county or sub-region has had zero homelessness for that demographic. For us, it would be veterans. For I believe it's between 3 to 6 months. So that's something that I think certain pockets in Arapahoe County have reached, and I think is very doable for the Tri-Cities region as well. The All Health Path outreach, so Tri-Cities homeless outreach efforts are managed in partnership with the All Health Network's PATH program. And as mentioned, it's social workers and case managers, and the PATH team makes contact with people who are experiencing unsheltered homelessness and refers them to services and provides street-level mental health care, and that includes housing and housing support. They are involved in our Built for Zero meetings and our case conferencing. So anytime they identify a veteran, they help to get them housed quickly and bring those cases to our case conferencing. The PATH outreach team provides case management as mentioned, and then the following slide will kind of break down what those outreach numbers look like month to month.
And remember, this is a federal grant that allows us to do that, so it is subject to renewal and it might go away, which would be a big deficit of services for us.
When does it end?
I want to say it was a 3 or 5 year grant and it started.
So this is another data point that is tracked monthly. So beginning in May of 2023, started at 41 outreach contacts, and that number's gone up to 116. So that just kind of shows the amount of services that are being requested and how much and what their impact looks like in the community.
Can I ask a quick question on this? Are those unique individuals, or is that just counts numbers, as in like there could be someone that comes in this month, that next month kind of thing?
Yes, so, but they do report on unique numbers too.
They do, okay.
And those are reflective in the Tri-Cities dashboards reports that are uploaded to the site monthly.
Great. What, if you just had to take a guess, proportionally speaking, about the number of contacts initiated as a proportion of, like, in terms of the totality of folks that could be connected with, what would you say? Like, are we now at 15% or, 40% of having initiated that outreach? Because this is impressive.
Yeah, I wish I could speak more to that.
I was asking you to go out on a limb, but it's okay, no worries.
Yeah, they do some pretty significant work in the community.
Yeah.
And yeah, there is more granular data available for All Health Path. And it's on the Tri-Cities dashboards, but I'm certainly open to getting those answers as well.
Okay, thank you.
Can I have a question? Does it show how many are repeat contacts? Person was repeated, in this month 3 times, for in the mental health type of things and, possibly ended up at the hospital or were sent to the walk-in clinic at All Health,
First
for evaluation. Does it drill into that? Because, as part of the key things for homelessness, mental health was one of those things. If they're not getting mental health help, they're going to remain homeless. And if that's not addressed, none of us in this room could help with all the money we throw at this.
Sure. That's a great question, council member, and I don't have those specific numbers. I do post the numbers for housing in particular, so individuals that have actually been connected to housing. But I can reach out to our contact at All Health and see if the more granular data that's related to exactly what the services are is available.
Great, thank you. And I would disagree with that premise. I think the housing has to come first. I can do all the mental health treatment and provide those services to people, but it's not gonna make a dent if they don't actually have somewhere stable to lay, sleep.
Is that the same model that Houston's doing?
Are they doing housing first?
Housing
Did
first.
it, yeah.
And they're very successful in what they're doing. So,
And they do track that, but one of the next slides, I think, will be the actual numbers of placement, and that's a good indicator to see how much are they actually placing people in homes, or at least in transitional housing.
right, and that would be a discussion I would love to have with you.
Sure. And the PATH grant, it ends in 2026. They will reapply, of course, and if that grant is passed through, it comes through SAMHSA, which is the federal, what does it stand for? Substance Abuse and Mental Health, something. Who knows what's gonna happen with the federal agencies right now?
So the next data point that I'll speak to is homelessness trends, and this is all the data that is extracted from HMIS. So the homeless management information system, it provides more real-time data. So that's sampling of individuals who are requesting homelessness services from local service providers that have been trained in HMIS and that can use the HMIS system. So while this sampling does not provide comprehensive totals, it is an ongoing indicator of the need and how many individuals are accessing services. So agencies in the Tri-Cities that are using HMIS and that are included in the data in the next slide are All Health Path, the Arapahoe County Housing Navigators, SAFER, formerly Mental Health Colorado, Innovative Housing Concepts, Englewood Housing Authority, and Movement 5280. So all of these agencies utilize HMIS, and I will speak a little bit about what that data looks like.
Did you have a question?
I did. With the HMIS, are the police able to either enter data or access that data if they're looking for family member, close family, or enter somebody into it so that they're in that system? What I've been able to hear about it, it's a very useful system.
It is, and that is a great question. I'm not sure if the police departments do use HMIS or if they have access.
I can answer that. It's actually prohibited. And so even our co-responders can't enter in. So for instance, like Emily in Englewood partners with 5280 primarily to get folks that she's working with entered into that system. But they have to go through a nonprofit.
About viewing, so if a family member is looking for them, they can't view to see if they're on the street somewhere.
We have to use our nonprofit partners for that.
And what can be done to reduce that barrier?
Well, the navigation center that Tri-Cities is currently working with Bridge House to build is going to be able to do that and be kind of that central clearinghouse. And they already have access to HMIS in their other locations, and that will be kind of that central part.
I'm sorry, my question is there a law prohibiting law enforcement from having viewing capabilities to just say, okay, this person has been reported lost or missing from a family, and if the police have contact with the homeless person, they could just look in to see if their name's in there, no other information.
I don't know if it's a law, Gretchen, you might know that, or, sorry, Councilmember Wright. We definitely cannot do it. We have lobbied the board for HMI, the MDHI. We have contacts on that board, and no one's been able to do it. So it's a very hard and fast rule that really protects people that are experiencing homelessness from being, targeted by law enforcement or, some of their criminal activity.
I just think you could view the name and no other information to just see if they're there. A simple fix to reconnect in family members if possible.
We can do it, it's just, law enforcement can do it, they just have to partner with the local nonprofit.
And that may not be a bad thing either, so okay.
So for homelessness trends, this kind of captures the data month to month, starting in April. And this is just all of the people that are requesting any kind of homeless service within those 4 or 5 agencies in the Tri-Cities that use the system. And the most current number is, as of October, is 226 individuals. The next data that I'll speak to is the McKinney-Vento data. And similar to the PIT data, it's one time a year data that's available that shows the rates of families who are experiencing homelessness within the schools. So this data is reported through the Department of Education annually, and they use different definitions of homelessness than HUD. So they define doubled up, so families that are living 2 or 3 families in one house as homeless. And this data includes students who fit the Department of Education's definition of homelessness. So those that are living in shelters, doubled up living, or living in a hotel or motel. Just to note, there were no reported students living unsheltered in the Tri-Cities region in 2023. So all of the data on the upcoming slide will all reflects sheltered. And though that is defined similar to HUD as students who are living in emergency shelters, youth shelters, or other places. Unsheltered students living in cars, parks, campgrounds, abandoned buildings, or other places not meant for habitation. So I'll start with the total for Tri-Cities, well, each city actually. In 2022, the total number of students experiencing homelessness went from 70 to 136. In Inglewood, the number of families went down from 214 to 143. And then in Sheridan, that number went from 53 to 218. And then broken down, what that data looks like is sheltered students in Littleton in 2022 went from 1 to 6. In Inglewood in 2022, that number went down from 44 to 17, and then in Sheridan, that number went from 3 to 23. And totals broken down from unsheltered students to those who are doubled up. In Littleton, in 2022, it went down from 6 to 0. In Inglewood, unsheltered students went from 1 to 0, and then in Sheridan, it went from 1 to 0 as well. And then doubled up, so families that were identified as having 2 or more families in one household. In Littleton, that went from 59 to 120. In Inglewood, that went from 148 to 116. And in Sheridan, that went from 42 to 183. And then students living in hotels or motels in Littleton, that went from 12 to 10, Inglewood 15 to 0, and Sheridan 10 to 0.
Jessica, question, how is this, I think I misunderstood, how is this data being collected? Is this being collected at the beginning of the year or?
I believe it's at the beginning of the year.
Okay.
So the school, I know the McKinney-Vento liaisons that I work with, they were starting that collection in September, so.
Okay, so when you're enrolling your son or your kid, they fill out that form at the beginning of the year, and this is one of the questions.
I believe so.
Do we happen to know any information about why these numbers fluctuate? Do we collect any information if they move out of the school district or anything along those lines that can provide us a little bit more information on why these trends are going up and down?
Yeah, that's a great question, Mayor. And I can get an answer. I'm not 100% sure what the process looks like with the McKinney-Vento liaisons, but I can certainly get an answer for that.
The biggest reason is the fallout from COVID. So remember, we had the eviction moratorium, which again prevented people. So when you were looking at comparisons between 22 and 23, right? 22, there were more that were sheltered, right? Because of that, and because of the extra ARPA money and other sources that were flooded to the cities to prevent homelessness. And that all ended, and now we're seeing the repercussions of market forces and the rising cost of everything resulting in some of that.
What's going on?
But I would, go ahead.
Just a quick question, this is by school district, not necessarily by city, because
It's by school district,
there could
yes.
be some discrepancies there as well.
I would also say too that, students that are in this type of situation are some of the most transitory students that we would have in a school
Right.
system. So if you're, staying with your grandma for a month and then maybe you move to your aunt's up in Westminster for a month, and they're really transitioning in and out of our school system and could cause some of this fluctuation
Right.
as well.
Absolutely.
I have a question. When you count a lot of these students, are you doing it just as American citizens, or are we talking like in general of homelessness? Because there's a lot of influx of people that come out here to stay with family members and go to the schools that are not from the United States. Are you counting them, or is this just?
Council member, that's a great question. And the McKinney-Vento liaisons, I believe they do report on
Any student?
any student who is going through the system. Okay, and so from here, I'll transition over to safe parking and give an update, and then brief overview of the data related to those to safe parking and the need for it. So point in time data does capture those who are living in their vehicles. And in 2023, that number was 10, and that went up to 47 in 2024. And that's for all of Tri-Cities. So just an overview of what Colorado Safe Parking Initiative is. Overnight sheltering in vehicles in existing parking lots outside of operating hours. So they support having a parking lot that is safe for those to habitate in. So access to bathroom facilities is one of the requirements for a safe parking lot, and access to resources, housing navigation, these are other really helpful components to having a successful safe parking lot. And it provides stability without criminal penalty, and oftentimes it's the first step back to stable housing for an individual. It allows them somewhere to sleep. It allows them time to go to work, to find a job, to find more stable housing without the fear of any repercussions. And then it decreases disturbances from unauthorized parking. So right now, we're working on a pilot program as part of the action plan. And we have about $25,000 for technical assistance for the community engagement piece of it. And that $25,000 is through Arapahoe County. It can be used for assistance with zoning, specifically for our Colorado Safe Parking Initiative representatives' time that they put into it, and then also community engagement. This funding has been extended through April of 2025. I know it says March here, but it is actually April. And it's very specific to just the pilot program. So this funding can't be used for any long-term operational costs. And there is potential for CBDG funds based off success of the pilot program. So that's something to consider after the pilot program, and if the pilot program is successful, what the long-term solution would look like and funding for that.
CDBG or federal funds, in case you were curious. So many acronyms. And just as a reminder to everybody, currently on all of our city councils, it is illegal for people to park overnight. So that is one of the reasons why we want some stabilization, because some people, if the neighbor or the person down the street's like, hey, I don't like that car just sitting there in the museum parking lot, they're going to call the police and say, hey, can you go and ask them to leave. Now, we don't issue a ton of tickets or citations, so we're not necessarily penalizing people in that way, but it's a great disturbance to that individual's, the job that maybe they're trying to look for, trying to keep, when they have to keep moving their car all the time.
Just to be clear, it's illegal to sleep inside your car overnight, correct? Because I don't think it's illegal to park your car somewhere overnight, it's just the act of sleeping in your car, right?
Yes.
No, the reason why I bring it up is
Yes.
that's a common concern I get.
Mhm.
Or trespassing on a property. Trespassing on
Yeah,
a church
trespassing.
property or something.
So operating costs for some of the successful safe parking lots, as I mentioned, long-term funding would be needed to help with supportive services and overall operating costs. And examples of this can be a case manager, security, admin time that it takes to actually operate the services for the residents. But bare bones minimum, what you need for a safe parking is portable potties, a parking lot, and a hygiene station. Case management is a huge benefit to it because it's really gonna help transition them out of safe parking into more stable long-term parking. However, it's not a requirement. And it can be, that can be where it gets more expensive and might be the largest expense that a lot of the safe parking lots do have. But certainly an essential part of it. And yeah, and as mentioned, the $25,000 right now would not support the long-term operating costs.
Cities of Arvada and Lakewood, I believe, have opted into this and have changed some of their zoning to accommodate support in this way.
So it's some of the next steps in action plan to pilot our safe parking in Tri-Cities. Right now, we have 3 identified sites who have shown interest. So there's been initial outreach conducted for 2 out of the 3 sites that we've identified. Bi-weekly meetings with 1 representative from each city, Englewood, Littleton, Sheridan, and then our Colorado Safe Parking Initiative representatives are present at those as well to help troubleshoot and work through any barriers. And then we also receive guidance from Colorado Safe Parking Initiative representatives at these meetings. And we will continue these bi-weekly meetings as we outreach to sites and gain more momentum towards safe parking. And have our pilot program launched by April of 2025.
So,
It will require a zoning change.
okay, so my big question is that I'm probably not identifying where the sites right now, so I'll ask what city are the sites in?
The cities that we have identified, some of the sites in are in Littleton.
I wanted one in each city. But beggars can't be choosers.
One of the sites is right on the border of Littleton and Sheridan, really close to Englewood. We'll see.
And again, the benefit, we talked about this last year when we met, the benefit of doing a pilot is that we can do some conditional zoning. Just to see if it works, to track the benchmarks on it. And CSPI, they have best practices. They've done this before in other cities. We're not recreating anything. They know how it's done. We just need to come up with the funding and the location and make it legal.
So Jessica, what are the requirements of the CSPI? Is it access to bathroom facilities, providing coordinated entry, and access to resources? Are those the requirements? Are there additional requirements?
So the only real requirements to start our pilot program would be the portable potties, the parking lot, and then a hygiene station.
That's it?
That's it.
Okay.
Denver does this, don't they?
Yeah.
And they provide security also, don't they?
Some.
Yeah.
Is security part of this plan?
Security can be part of the plan. It's all contingent on funding and what can be funded once we launch the pilot and we see how successful it is. But there are sites that in the Denver metro area that do have security as part of it.
CSPI does have a paid employee that would be on site.
Yeah, I don't know if I'd qualify it as security so much as maybe site manager or something like that.
Yeah, but they can certainly call for help if there's needed.
The sites that have been identified, are they private property or public property?
Private. And that private property owner would also have a role in what kind of services they would want to provide. Would they want to provide meals? Would they want to provide showers? So that is kind of an open dialogue. That's why we're focusing on churches, because they have some of.
But they would also be responsible for the security as well.
No.
If they wanted to provide security.
The program could too.
Yeah.
CSPI.
Okay.
If we wanted to include that in the scope of work and fund that, we totally could. I have less concerns about security because parking is slightly different than what we're used to with other temporary shelter options. They have doors, they have places to store things, so the community is a little bit different. This isn't just I'm random and I'm living out of my car and I'm gonna stay here. I have to go through a vetting process, which means I have to be placed at these sites, which means they're not public. I can't just drive into any of these sites. I have to go through a space and so I have less concern about it being as transient as you see in maybe some other, what we call low barrier shelters.
So they limit and reserve the spots
Yeah.
for people who are approved to be there.
And what happens is natural security happens because they're vetted, they have a place and they know that they have that place. They don't have to drive around the next night to look for another place. It's secured in that space. They kind of have a community that's created.
They don't want to ruin what they have.
Right, and also best practices is they don't stay there 24/7. They come in the evening, they park, they spend the night, and in the morning they leave.
I believe many of them have jobs.
Yeah,
You know,
most of them are gonna get out in the morning and drive to their job.
Exactly.
So we had someone, I was not on council yet, but I was at the meeting when someone, Safe Parking from probably Denver or an organization came to present. And one of the concerns they had that is a big barrier is you have to have a valid license, you have to have valid plates, all these things. Are those barriers going to be taken down for some of these people? Because they're looking for a hand up, they're trying to get into their own place. And when you have all these barriers just to park in a parking lot, that becomes a barrier for, oh, you're not welcome because your plates aren't up to date.
As part of the enrollment process, they do help some people overcome those barriers. If someone's not willing to, they won't qualify for the program, but they can provide help for those situations where someone needs a little help.
Okay, so it's more than one type of hand up. I like that.
But in this vetting process, this entry process, is there certain rules they have to follow? I mean, I'm thinking drugs and alcohol is like top of mind.
Yeah, the way that Colorado Safe Parking does it, I mean, they'll remove somebody from the program if they're not a responsible neighbor.
Because I would imagine that there'd be families that would be involved in this probably often. And single women, and I'm going through all these things in my mind.
We need to move along. Thank you, Jessica. We'll move on to the severe weather sheltering subcommittee update.
Glad there's excitement though for this pilot. It's coming.
Okay, well, I guess it's my turn, and Liz Ramsey, so I will start. We could go to the next slide, please. Thank you. So what had happened in July of this year, as you all could recall, we had a extreme heat advisory happen, and a few things happened that kind of raised my antenna and thought, we're having heat advisories, and I was alerted to it, and I saw some of our homeless friends out there. What's gonna happen when the winter happens? So I got with Sean, I'm like, I think we need to grab our cities and our partners together and stuff, and maybe we need to come with a plan. So it was a Tri-Cities subcommittee that he's like, why don't we put this together? So we had a lot of people in this room on calls, along with a lot of nonprofits, the police, Parks Rec, Arapahoe County. Like I said, a lot of people in this room and a lot of nonprofits that got together. And in July, we had our first Tri-Cities subcommittee call to form a partnership and come up with plans for weather conditions and what would be done for both severe hot and severe cold. So if we could go to the next slide real quick, please. So what we did is we identified temperature standards to set a precedent for the severe weather. I forgot what the S is. I did this earlier. Shelter, thank you. We established, it's this corner.
It is this corner. Yes.
We established a real-time communication system with the subcommittee when one or more shelters may be at capacity. So that, and this would be, so let's use a warm air cooling center, for example. So if the libraries are packed, we could communicate with each other and say, hey, we can't take anybody else. And the next coolest would do it. And Liz will get into it a little bit more. We identified primary overnight shelter in the Tri-Cities to serve as main overnight shelter during the winter season. We've linked resources and have resources available to other nonprofits and homeless services to prevent severe and present severe weather shelters. And then we identified transportation to and from severe weather shelters and overnight shelters. And then communicate information to all Tri-City members as well as the police to identify distribution tactics to homeless individuals to ensure they're aware of their options. We were on calls every 2 weeks for a few months now, putting this all together. It was a collaboration. Liz is gonna get into it more, but I personally wanna thank everyone that joined those calls. I asked a lot from everybody. Devin, I haven't been able to talk to you yet. I want to thank you for being on there. Every city that was in partnership on this, it was a big ask and we got it done before the first big winter storm. And we were communicating, so I think that possibly we saved lives with this storm that we did not expect to be as big as it was. So Liz will get into more of what we did here.
Yeah, so one of the biggest things that we did with this group was eliminate some of the confusion that was happening with the term shelter. So we decided that the term severe overnight weather shelter would only be used for those overnight shelters, and that for the daytime heating and cooling centers, they would be referred to as centers. So there's that distinction of daytime and overnight services. And then we also set the standard for the group that everybody would be responsible for training their staff at these definitions so that communications would be standard among the Tri-Cities. And so just the little differences, obviously overnight shelters are gonna shelter overnight, and then heating and cooling centers, those places provide somewhere to sit, access to water, and then somewhere to warm up or cool down during their normal business hours when they're activated. So next slide. Awesome. And so these are the two major nonprofits that are providing severe overnight weather sheltering for the Tri-Cities. The first is Hat Force and the second is Movement 5280. So Hat
The
Force.
only ones
Yes.
that provide, let's be clear, they're the only ones that provide overnight sheltering.
So Hat Force is the one that makes the weather decision. They make it daily between 8 and 9 a.m. They post that on their hotline. And they can determine it for up to 3 days in advance. So you can call their hotline and get their weather decision, whether it's going to be a severe overnight shelter or not. And then Hat Force and Movement 5280 have this kind of staggered timeline to help accommodate all the clients. So like I mentioned, people who are needing services can call the hotline daily at 9 a.m. to get the weather determination. If it's open, pre-registered clients can reserve their spot between 10 a.m. and noon, or until it's full for that night. And then reservations for the unregistered clients begin from 1 p.m. to 2 p.m. Only if there is still room available. And then at 2 p.m. that hotline is transferred over to Movement 5280 where they can call and get services. Movement 5280 serves as the overflow shelter. And so next, this is just a visualization of the timeline of a typical shelter day. And so that kind of shows you the staggered timelines of when people can call and get services from each organization. Next slide. Okay, so these communication standards, I'm not gonna go through all of them in detail, but pretty much the standard we set in the subcommittee was that 72 hours before the event, when possible, internally we would begin communicating over whether they would open or not. And then 24 hours before, we're gonna communicate that externally to some of our nonprofit partners, and then they're gonna help disseminate the information to clients. And you guys all have a handy dandy little handout with all of these communication standards, which is why I'm not gonna go through them super detailed. So 24 hours extra communication. And then we also we developed workflows for foreseen and unforeseen closures of our heating and cooling centers. That's kind of where we ran into most of the issues in previous years. If, say, like a library was closed for a day, or if somebody had to shut down early because of weather. So we developed these protocols so that these providers of daytime heating and cooling could communicate. We are on a Slack channel, not a Microsoft Teams. That changed at the last minute. And moving over to Slack actually made it easier for us to connect with the nonprofit partners because they were already on the Slack channels. And so it's much easier to communicate with them. And so all of these are designed to make sure that we have standard communication. Everybody's kind of in the loop of what's going on. And then also we had a few additional tools that the subcommittee developed, including a calendar of expected closures. So like for federal holidays, a lot of city organizations close. We also have a resource book that people can enter things in. And then we also have a template for closures and alterations of hours so that if unexpectedly a heating or cooling center has to close, they can post it on their door. And that template has the 3 3 nearest heating or cooling centers, so that if clients come up looking for resources and it's closed, they know what's closest to them. And then the subcommittee is going to meet twice a year to review these processes and procedures to make sure it remains current for both the winter and the summer season.
And the reasoning behind moving away from Slack?
Moving to Slack?
We are moving to Slack.
So
Okay.
we moved the subcommittee to Slack just because Microsoft Teams, we had issues with permissions and
Right,
everybody
yeah.
getting access.
Okay.
So Slack was the easier option.
Has there been any outreach to other, for the severe weather sheltering at night, have there been outreach to other churches or any other facilities to pick up outside of just Half Force and Movement 52A?
They would have to get approval and get fire watch and everything else. If
I'm
they
just-
wanna step up,
I'm just kind of curious if anybody else has potentially reached out. Okay.
Has there been more, are we seeing more demand this year than in the past? And that's, is there, one of the things that concerns me is, I don't know, are there other cities or regions that are doing vouchers, or is it mostly concrete sheltering?
I don't know the answer to that outside of our region.
I got the
Is it
impression that.
financial?
Huh?
Is it financial?
Maybe, well, I was just wondering if we're the only region offering hotel vouchers,
Right.
the word gets out and now suddenly we have people coming from Denver and other regions to come get a voucher, and so we have kind of an induced demand thing where we're expending all of our vouchers on people who aren't particularly from the region.
Mayor Pro Tem, this is a program that you have to be pre-registered for.
Uh-huh.
And so during this last storm event, they were contacted by a number of people in Greater Littleton, i.e. Jefferson County, that were not given vouchers.
Okay, so they're filtered based on where they
They
say
are.
they are located?
Where they're at, yeah. And so we did reach out to Jefferson County's Human Services to tell them about this demand and the opportunity. Half Force would love to give them service if they were to partner, but at this point.
What is
it hasn't
that
been.
verification process that they are?
Yeah, I'm not sure.
Is it the MHIS system?
I'm really not sure.
Okay.
I think they have their own system. I will say though, yeah. we
Half Force
have-
does?
Yeah. When they first started registering, all of their events were in the Tri-Cities, so I think they were trying to capture most.
Yeah.
And I do know that they got, because of severe weather, network shut down and Hat Force took over, they were late on starting to register their people too. So normally they go from October 1st to April. I'm lucky we didn't get a snowstorm at the beginning of April. And this storm that we got also, I'm grateful that 5280 was available because one of those days,
Half Force did not pick it up, right?
exactly when was the election? The 6th. And I think there was some lives saved because of 5280 opening that night, because it continued to snow and it wasn't forecasted to snow. So, and they can't predict that either, so, there's some grace there also, so.
So quick question, and any reason why Half Force is not on MHIS?
Well, their caseworkers would be, or doing the case, any of the case management support. But to answer your question, Nathaniel, about churches, when Severe Shelter Weather Network decided to close its doors, and they did it very quickly and abruptly, that didn't give us a ton of time to really think through a strategy. In my opinion, 5280 and Hat Force is not a long-term strategy for managing our unhoused. So one of the charges we gave Jessica was come up with some deliverables, a longer-term strategy. We knew we couldn't do it for this calendar year, so that's why we were very grateful to Arapahoe County, who jumped in with some funding to fund Hat Force, and grateful to some of our councils who could chip in some money, and also to the state of Colorado, to the Department of Local Affairs, who was able to do an emergency grant to provide them funding. And your question, Joe, Hat Force really does have capacity. So because of the money and the flux they've got, they have more than 50%, they're only at about 40% capacity. So they do have more to fill anything that might come, which surprised me. I was like, oh, really?
Yeah.
Okay, because I thought it was much more, so that really assuaged some of my concerns, but it's not a long-term strategy. We're hoping to do some of that research, and maybe that does include going to some of those churches that were originally part of Severe Shelter Weather Shelter Network, man, it's this corner.
Yeah, it is.
And maybe there is a church now that has a new social justice mission that's willing to take this on. But we don't know that yet, but I think we should be asking those questions.
But it
And
just,
she gets
just goes-
away.
it also goes to show you how vulnerable the system is though.
Yeah.
One player can drop out and we're scrambling like crazy
Right.
to figure this out, and it really was a scramble. This is a Band-Aid at this point
Right,
now,
and
but
my
yeah.
question, I need to get over, my question to Gretchen is, what do you mean at capacity? They were able to do 60 vouchers per event, so what is capacity?
But they're not filling that. They were not filling that as of
They-
last year, so
oh.
that means they have that
But
capacity
they
to
did
manage
it,
that.
but this storm, they did.
That was last one.
They
They will be
all
at
of them.
they will be, you know, but they have the bandwidth. We don't have to worry about them running out per se yet. And that's both 5280 and Hat Force.
Right, cause 5280, oh gosh, I should have gotten the numbers. They were almost at their fire watch number every night. And then the nights that Hat Force did give out vouchers, they gave out all 60. So,
There's definitely a need for shelter space. There's
Oh, I
argument
agree.
on that, right?
Well, and
Yes.
Hat Force is hotels, and there are currently, they don't have, I think they just might have one hotel in the Tri-Cities area. So that means they have to transport clients to hotels that they do have relationships. So people are in Littleton, their doctor's appointments are here, but they're still having to travel to the hotel in Aurora that they do have relationships with. So if you have relationships with hotels in this area, it would be great to broker, to introduce them to Hat Force's executive director so that we can cut back on some of the transportation costs, especially since we're using that as our model this year, primarily Hat Force.
or any churches willing to.
Thank you both for that presentation. We're gonna move along, because we're running short on time here.
Yeah.
We're trying to get done by 8, but I don't wanna, cut us off, because we've got the future to talk about.
So it says 20 minutes, so I'll try not to do 20 minutes. I'll try to go as quick as possible.
This
But
is
as
the
Mayor-
exciting part.
Yes, it is. But as Mayor Brighter-Fleur mentioned, and as Councilmember Ryden added to, this is what we've been talking about is what we've done in the past and what we're currently doing. The next 20-ish minutes, we're gonna talk about what we would like to do in the future. So today is really meant to be kind of a final brainstorming. So what you're going to see and what you have in your packet has already gone through the vetting of the city manager offices, as well as the Tri-Cities Policy Committee, the large group, as well as the steering committee. In December, so there's two items that'll be coming before your councils related to the next steps. December, the plan is to bring an IGA forward. I don't know the exact dates in every city. In Inglewood, it will be on December 2nd and December 16th. The IGA will be related to the funding part. The good news about the funding part is that it will completely be coming from ARPA dollars, and almost all of these projects have already been budgeted for by the three cities. So we're really not looking for new money in that way. The important part though about approving that in December is in talking to all three of our finance departments, ARPA funds have to be encumbered by the end of 2024 and expended by the end of 2026. So an IGA does count as an encumbrance, and so that's why we're doing this now. The second item that will be coming before your councils likely in January will be an approval for your consideration of approval of the actual second version of the action plan. So tonight we're gonna do a quick overview. So we're proposing 14 projects. 11 of these projects you've seen before, they're already in the action plan. We're only proposing 3 new projects, all in the governance area. We are also making a recommendation to sunset, so as you probably know, there's 4 themes. The governance theme, individual or chronic homelessness theme, family theme, and workforce development. We are recommending sunsetting, and what I really mean by that is we feel we've made so much progress in that area with the project implementation, but we also wanna move to a different phase of the action plan, and we'll talk about that at the very end, where we wanna have performance metrics. So we don't wanna just say, great, we've opened the doors of these programs and these initiatives. We wanna have really strong metrics that Jessica will be working to report on quarterly, so that's gonna be a key part of this as well. I do wanna point out there's a next slide that has some figures related to funding. We just finished the IGA today, so they're a little bit different, so I'm going to quickly go through what the numbers are. I will say the numbers are correct in the tables, they're just not correct on this bullet in the next page. So we are expecting the total project cost to be $185,000. In addition to that, and thank you Littleton is adding an extra $62,500 to the cost. And the total annual cost of the Tri-Cities coordinator is estimated to be $120,000 per year. Obviously with Tabor, we can't say right now we're going to agree for 2 years. But if we did, the total cost for the action plan, including the amount that Littleton is adding in addition, is $487,500. So that breaks down again to $120 per year for the coordinator, $185 for the projects, and per city, it's $275 for Littleton, again, including that extra funding, $170,000 for the city of Inglewood, and $42,500 for the city of Sheridan. Again, these funds have already been budgeted through ARPA, and that's if we use all the funds and we go through. I talked about the performance metrics, so I'll go to the next slide. Again,
Just a reminder to my council members, that is the money that we had already allocated from ARPA for unhoused. We talked about this a couple weeks ago, so it's not any new money for us.
And I should also mention too, Councilmember Wright, that all of the funds that we have here were already as part of the original action plan, so all 3 cities had already agreed to it, so we're really not looking for any additional funding. I'm gonna go over the governance theme really quickly, and then I'll turn it over to City Manager Becklenberg to go over the next theme. So in governance, again, this is the only area where we're proposing 3 new projects, and really what we're trying to do here is think about the future. Governance is an area where I think we've accomplished 80% or so of our projects. We created a strong foundation. That's how it was framed in the original action plan. That's exactly what we did. Everything from hiring the coordinator to a lived experience advisory board. Obviously, we're recommending to continue those things, but we also really want to invest in where do we go from here? So the first bullet that you see here, the first project, is the creation, and again, that actually is a typo, it's a long-range governance sustainability model is what it should read there. So that first project is about figuring out the long-range sustainability of Tri-Cities. What does it look like? How is it housed? What does the cooperation between the 3 cities and the county look like? It's spending the next couple years working on developing that model. Then the next 2 are the financial sustainability. So the first one is hand in glove to development of a long-term governance structure, is also figuring out long-term financing. We were doing this work, we started this work at a time of unprecedented federal funding for homelessness, which was a great thing and also a challenge. Because it was a great thing because we had money that we never thought we would get from the federal government. The challenge is that we all knew it was one time, and now we're coming up on that one time end, right? It has to be expended by 2026. So we need to figure out what that looks like going forward. That last project there, a hosted fund, the concept for that and a hosted fund just really quickly is a fund that's hosted through a nonprofit that does this professionally, something like the Denver Foundation. The idea here is acknowledging that homelessness is a challenge that we all face. So the city is an important, the cities and the county government entities are important actors. We're not the only actors. And so by having a hosted fund, it's a way that individuals, nonprofits, school groups, children's groups, businesses could contribute to our work. Do we think that having this fund is going to solve all of our financial issues? Absolutely not. But we think it would be one way for other organizations to be a part of this. So that's just one idea we want to explore, and I'll turn it over to Jim for the next step.
Thanks, Tim. Yes, as has been said, really, Action Point 2.0 are the next steps and the extension of many of the themes that you've already heard tonight. So I'll just go over what those might be and those things that we're looking to explore. First of all, we're looking to create an online platform to request homelessness services. I would think of this as the extension of the navigation center that will be opening this spring. That's a physical place to find help. This would be a platform online where folks could go in and look for services, request help. Right now, we know that many of these kinds of individuals seeking services call a police departments, for instance, and we think that this could be a much better place to look for services than that call to police. Next, you've already heard a lot about the safe parking program, but our plan is to find the right site and secure the agreement with Colorado Safe Parking Initiative and implement a pilot program. Next, we're looking to continue to engage our local healthcare providers and expand those street level medical teams and services. You heard mention of the STRIDE program that serves areas in the rest of the metro district. They're eager to look to expand here, and we're eager to have them, so we'll be looking to formalize those agreements and services. Next, shared housing. This is a concept that we're familiar with in some other areas, but we'd love to find a model whereby individuals could share their home spaces with those who need housing. So make that easier. Make sure that we'd like to be able to facilitate those connections so that we can house folks within, within homes where someone might have a couple bedrooms or could help someone else with that. So that's a real possibility. Outreach to landlords, this work is.
That might include changing some of our short-term rental policies. So just FYI.
Thank you, good point. Councilmember.
How change them? What do you
Well, right now, they're kind of burdensome. If I have an extra room and I wanna rent it out and I wanna do it legally, I wanna actually not just post it on Roomster or whatever, I wanna actually like register it with the city. There are a lot of challenges in place to do that. So it might include looking at individually, what is that process for our cities?
Next would be to strengthen the outreach to landlords, and some credit to Jessica on this, she's moved this along already in her time with us. This is really, working with landlords, trying to find some funding and work to offer subsidies for things like payments up front, we could offer some signing bonuses for people, help with minor repairs. It can help landlords to make units available sooner for folks. So those kinds of help we're finding can make a real difference. So we want to keep those going. And then finally, probably a large potential initiative is to conduct a feasibility study for permanent supportive housing. You may be familiar with this, but this is an actual community or structure that would have a number of units. Some of them in the area have 50 to 100 units that could offer aid to folks who are just coming out of homelessness or are on the cusp of entering that state. And the key here is that they have wraparound services. So they are staffed and they are there, with those services to help people get assistance they need as they are trying to find their next independent living situation. So with that, I'll turn it over to Devin, who I believe is going to talk about the family system initiative.
Thank you, Jim. And again, just to reiterate, we've had these family system and some of the goals and action steps on here since the beginning. And we really, in those focus areas, we really kind of prioritize the first three, say, over the family. Not that it's not important, but we needed to focus somewhere. We needed to prioritize, and we prioritized because Gretchen was saying, what was our most visible, what's our most immediate type of issue we need to do? And that was the individual chronic homelessness, but understanding that we still don't want to lose sight of the family system. And I think that what we saw from the McKinney-Vento data and some of the information we saw on that, how important it is to engage the schools when we're talking about families. That is our entryway. That's how we get a hold, and that's how we reach out and help these people is through the schools. I think it was Gretchen was saying too. Some ones we have engage the local school districts, kind of obvious right now. Designate a lead service provider to help us with that. And I know that Jessica's working on this, I think, right as we speak even, and talking about that. Collaborate with the school districts. And prevention, a lot of what we really want to focus to with the families is the prevention side where we can on that, because a lot of these folks that we see, they're not unhoused. So or not unhoused, I should say, they're not unsheltered. They're sheltered right now, right? How do we keep them from taking that next step out and then they're not unsheltered? Or how do we prevent them or help them step up from taking that next step? A peer support specialist program, again, to help with the outreach side of that side, to reach out to those families. And then, work with our housing authorities to look at expanding the housing choice voucher program and seeing what assistance that might be for them as well. So, my takeaways on that one is really, how do we work with the schools? How do we help them? How do we work together on reaching out to those families? The numbers, I think, when you see in the McKinney-Vento, it's staggering. I heard people go, I heard it, you could hear it as we saw those numbers pop up. People are like, wow, holy cow. It's surprising because it's not visible, right? But we know it's happening, we know it's in there. And our council in Sheridan, this has been one of our primary focuses is how to do that. In our school district is doing some great work. With some grant work in hiring people and doing this type of outreach and helping people. So hopefully continue to expand on those as well, so.
Great, so
Are you gonna talk about this, Tim?
Yeah, I'll talk
Cool.
about this.
Yeah.
Yeah, so I'm gonna cover this last part before we conclude and have time for questions. So even though Jessica's done a phenomenal job of tracking performance metrics, they were not formally part of the action plan. So one of the reasons why we're asking for a lot less money than before is we really focus on investments and trying to basically build programs, build initiatives, sometimes literal brick and mortar initiatives. And we still have 14 or so projects we wanna work on. But we also do, to an extent, want to move from the development or implementation phase to a monitoring phase. And so we really want to have robust performance metrics that we're tracking in a variety of different ways to help us understand the bigger picture of homelessness in the region and also some of the how some of our actions are working. So the first metrics that you have here under governance, and these are things that you saw before, these are kind of the overview metrics mostly coming from the point in time count that we do every year. It's just intended to be a snapshot. It's not intended to tell us everything about our homeless population or how we can help them, but they're important kind of overview metrics. These metrics for some of the programs, so safe parking, these are metrics that are utilized in the Colorado Safe Parking Initiative, so we thought they may be helpful to monitor if we do launch a pilot here. The Navigation Center, these metrics are actually in the contract. So these are performance reporting requirements from Bridge House to Tri-Cities, that's why they're in here. Same thing with workforce development, the metrics from Cross Purpose and Bridge House Ready to Work, those are in their contracts that they report on for a couple of years after the contract ends, and they've both been great about sharing data even when they're not required to do so. And then finally, the family system metrics are the ones that were shared previously that come from the McKinney-Vento requirements.
Yeah, I just wanna highlight that this action plan that we all adopted 3 years ago, it's done or in progress. Like, when does that ever happen, right? We actually have a plan that we follow through on, and that's pretty
A lot of the initiatives are focused on prevention, on making that cross purpose, even safe parking is to prevent unsheltered homelessness. Is there any way we can track that metric of prevention?
Yeah, it's very difficult, and I think it was kind of mentioned before, the easiest way, well, it's actually a very hard way, but the best way with performance data to understand in the homeless population whether there's an impact is to have like a by name list or to have kind of a very small list of people who fit into a different cohort. So example, people who have fallen into homelessness that are veterans, or people that are at risk falling into homelessness that are families. So the more data we have, the Navigation Center I think is gonna help us understand that picture. But yeah, to answer your question, it's very difficult and it's really best if it's done by small segments who have similar characteristics.
I think that's part of this bigger picture that we're trying to get at, that would be helpful to continue to explore. And my other question was, I noticed in the kind of 2.0 version of the plan, the housing projects are all existing. And when we met a year ago, we talked about what's our vision for the next kind of version of this group, and we were talking about doing more things on housing, but I don't see new projects there. Is there discussion on that, and is there still an appetite for new or just the steady state?
Yeah, so I'll kind of start that and maybe the other cities wanna chime in. Absolutely, but what we realized though was the permanent supportive housing feasibility study, we really wanted to be a cornerstone of the additional work. We were very lucky to find Jessica, who has a background in housing. That was one of the reasons why we brought her in. But I think we over time would like to add some additional ideas to discuss with you. I think the other thing too is that all three cities are also kind of tackling affordable housing outside of this group, but also in tandem and in conjunction. And so we want to see that work also go into fruition. But really the main reason we didn't add anything to this plan is we really wanted to get that permanent supportive housing study done first.
No, I think that makes a lot of sense, obviously we want data and the research to go forward. But to your exact point, and I will just throw it out here, we are all working separately on affordable housing efforts and initiatives. I understand, Littleton has even considered something currently. Regionalization, everyone knows, is what we need to do in housing, but no one wants to do it because it's very scary and very hard, and no one, I don't think, has been able to crack that nut. But we have some existing trust and infrastructure here. So to the extent that it makes sense for us to start having more regional conversations around affordable housing, especially when it comes to preventing homelessness, I think we might want to consider some of that. And so to the extent that there's an appetite for my colleagues at the table, I count me in as a partner to at least start having, a coffee or a conversation of what that could look like, because I think it's a really natural next step for this group.
I'd be very supportive of, for the whole 6 weeks I have left on this council, but of adding a recommendation that promises some kind of implementation of that, either that feasibility study or actually a commitment. I mean, again, you're right, we are all doing some siloed things around affordable housing, but maybe there is a deliverable about coordinating all of our individual studies into something more regional.
I just wanted to point out, as we look at governance and the need for continued funding, there's a large amount of opioid settlement money that hasn't been expended yet, and I don't know if we've actually examined how that money might interface with what we're doing here, but I think there's some potential opportunity there.
Steve, I think a little bit like on the co-responder side,
Yeah.
and that's been really kind of about it, I think, at least on the topics we've talked about tonight and the opioid money.
There was more of that.
Yeah.
You need an expert on the opioid task force, and I'm afraid I'm the best person you got. We can talk more about it, because I'd like to bring it to the group. There's been some resistance on co-responder related spending. I just think it's because we don't have right people there to be able to articulate exactly what's needed. I don't know if Commissioner Fleming has a different idea, but.
I'm excited. Something like Safe Parking Initiative, which it has wraparound services built into it. I think that could fall into one of the buckets for the opioid resettlement money. So I think it would have to be some of those, projects, those 15 projects, finding one that would be appropriate. That could easily be a good funding stream. Not necessarily long-term, because as you know, with the opioid resettlement money, it kind of dwindles over time. But, if we're just looking for 2 years at a time, that's something to, especially for the pilots, that's a great idea, Steve.
And the mobile units, the mobile response, that might be possibly another area as well.
Or maybe stride.
Yeah, stride.
That could be in the harm reduction category.
Yeah.
Mhm. Yeah.
How many, last year, the question was asked, how many people through Tri-Cities became housed? Between when we met last year and this year, do we have a number of how many people received housing through Tri-Cities?
Yeah, I think it's on the dashboard, isn't it, Jessica? Didn't we capture that?
So, right now, Innovative Housing Concepts is the only housing authority that reports into HMIS, and it's only on a small data set. It's the data that's related to their housing coordinator, I believe, who works with the McKinney-Bento families. So I'm sure I could find it somewhere. I don't have it readily available though.
I feel like I've seen those numbers, so if you, could find that.
Sure.
Because I think it might have a requires of extrapolation and some other sources, but we do have that.
But it's also important to remember that the Tri-Cities is not a direct service provider. So we are helping organizations help, people. And, we're providing funding and we're providing infrastructure, but we're not a direct service provider.
But the county is.
Huh? When people are calling us, can play the bad guy and saying, cities and the counties providing money, how many people have ended up housed? We have to answer those questions.
Well, part of that is through Arapahoe County, we have rental assistance programs that we can track how many people are being helped and, you know, what is that number? And though that is what, they can run those numbers for us.
Right, and I guess the other question I would have is, you know, throughout this last year, how many people have graduated through cross-purpose and have remained in those positions that cross-purpose had trained them through?
Well, I'm sure Cross Purpose has their numbers of their success rate and what they can do, and I mean, I know that the county, when it comes to housing and some of the prevention that you're speaking to, the county does also partner with some folks, with Colfax, legal system, and a couple of, another provider that helps to help people that are potentially being evicted. So that's another way that we're trying to prevent people becoming homeless. So, but I know that Cross Purpose, as well as Bridge House and Ready to Work, as we said earlier, they track their stuff very long term.
Both cities are required to report back to us with their outcomes, and I was able to find some data really quickly that they have 160 graduates at Cross Purpose since they opened in 2021. I don't have the data at my fingertips, so to the direct question you asked about whether they're still employed, but they've been great about providing us with information, so I'd be happy to reach out to them for that.
And Jessica, if you can just follow up too, and maybe just email the whole councils or maybe the managers, and then you guys can get it out to the councils. Does that make the most sense?
Sure.
Sure. What those quantitative numbers are, and I think that should include what Arapahoe County, would that be Lizzie? Who would have those
What are you
numbers?
looking for? I'm sorry.
The numbers for how much rental assistance has been provided to how many individuals?
Jessica.
I think that's important too, to see that number.
We can see how, yeah, for sure.
And we can split that, because we don't get to report on that per se, but I've reported to my city council because I was in those meetings, but that's also very promising to be like, okay, the need is happening and it is being met by our county. To some extent, I still think there needs to be more money in those buckets, but.
Just to remember that a lot of that funding was ARPA dollars. And we have just about to reach, I think March is the end of that funding. And then we go down to what we normally would get. That's.
And that's federal pass-through, so like that's coming from HUD dollars, so that again is also contingent on what's gonna happen with our federal agencies.
Yeah, a lot of that was one-time funding, either home ARP, American Rescue Plan, CDBG, CB had one-time funding. But yeah, almost all of that has been allocated, if not spent.
And then what is our typical allocation is like $30,000 or $40,000, isn't it, for rental assistance?
Yeah, so, yes, I would say typically, and that was more emergency-based community development block grant funds. In years past, we did partner with IFCS, Integrated Family Community Services. We have partnerships with Task Force to do stuff. I'm not on the, emergency rental side. But yeah, we've done, I would say between 20 and 50K in the past. CDBG is very limited in just programmatically doing public service activities. We can't spend more than 15% on those projects and activities. So it's very minimal, what's available for rental.
My key takeaway is that the services are very vulnerable. And so we need to be mindful of that too with what's available. And we can't bank on, like I said, the path outreach, even All Health being able to provide those services, or, Hat Force being able to maintain it, or the county being able to provide that rental assistance. So that's where I do think we need to make sure we're thinking through, and that's why that's a recommendation in the 2.0 plan. How do we think through a long-term investment strategy for making sure this work is sustainable? Because it's really important.
I do want to thank everyone that's been involved with this. there is a lot of good work being done now, talking around to other communities in the region that they look towards us to see what we're doing. They said, wow, how did you guys do this? You know, people be proud of what we've done there. So all three of our cities and the county as well. Colleagues over in Jefferson County don't see the support as much from their county commissioners as we do here. So thank you to our county for. There's a lot more work to do, but I think we should be proud of what we've done.
And then just close with the final steps that we're planning. So we've taken a couple of comments that you all had, the opioid, the regional affordable housing kind of initiative. If there are other things that you want to see added to the action plan, each of your councils will have an opportunity to discuss that. And the plan is to take these back to councils for final approval in January.
The IGA will be coming in December, in a couple weeks, and then the action plan we really want to bring in January.
Yeah. So there's time between now and January. If you wanna, add things and your council wants to add things, we can get that worked into it. Then have a discussion among the managers about what each city kind of wants and needs from the action plan, so.
Special thanks to Tim for leading 2.0. I mean, we hired a consultant to do that 4 years ago, so.
You jumped my thanks. I would like to just recognize and thank the city of Englewood for over the last year. We've had some transition in the kind of staffing of the steering committee and of the policy group, and certainly Littleton City Manager's Office has had a little changeover in our staffing for this project. And Tim, I want to really say, has just stepped in with his, expertise and passion and moved a lot of the staffing work forward, and just his leadership on this presentation is very much appreciated. So thank you, Tim.
Also, Elizabeth did a lot of hard work on the severe weather, trying to figure out all those different moving parts, so thank you for that.
She jumped right in it when Will left, so.
And I've asked Jessica to post that plan on the Tri-Cities website, so that is where you can point people who ask you about that when they're like, what do I do? I'm so worried about, so I see so-and-so who is freezing cold, it's below zero, what do I do? You can point them to that resource about that, this is, what our policy is, this is where they can go, this is who they can call.
It's a great idea.
Thank you, everybody, for being here. Thank you for your input.
Thank you.
Thank you for Littleton.
Thanks for hosting.
Yeah, great presentation.
Thank you.